it too late to get a flu vaccine?
It's really important to get a flu shot in the early fall or early winter because flu season really typically starts to march up in November, peak in December and January, and then start to dissipate typically in January, becoming February. But it's really never too late because if you don't get it in the fall, there's still a chance you could be protected as we go into January and February. So while it's ideal to get the flu shot before flu season ramps up in November and December, it's really not too late in the winter to get a flu shot.
Who should get a flu shot?
Everyone older than 6 months up until the elderly should get a flu shot. We used to have different recommendations for what ages and what at-risk patients. Every citizen from 6 months until they're in their elderly years should get a flu shot across the board.
Can a flu shot give you the flu?
Common misperception that you can get the flu from a flu shot. The problem is everybody's probably got an experience where they either get sort of muscle aches after they get a flu shot or just aren't feeling well. That's typically not the flu. Or worst case scenario is you get your flu shot and really get the flu a couple days later. The flu shot is meant to boost your immune system against the flu. There's no way that a flu shot can actually give you influenza. The problem is some people associate symptoms they have right afterwards or, goodness forbid, getting the flu right afterwards. The flu shot gave me the flu. You do not get the flu from a flu shot.
Do I really need a flu vaccine every year?
You need a flu vaccine every year because the CDC changes the different viruses that we're protecting against because they look at what last year's viruses were. They try to predict as best we can what viruses we think we're going to see this season. So the makeup of the flu vaccine changes year after year. That's why, unlike other vaccines you need once in your lifetime or maybe every 10 years or so, you really do need a flu shot every year. And there's a couple really good common sense tips. First and foremost, wash your hands frequently. I actually have a little bottle of Purell that I keep with me. Second is to avoid touching your nose and your eyes and your mouth as much as possible. Third is probably the most important. That's everybody should get a flu shot. From 6 months of age up until the elderly, everybody should get a flu shot. And then finally, goodness forbid you do get ill this winter, it's important to stay home. Stay home for at least 24 hours after your symptoms have abated. Your fever's gone and you're feeling better, because if you're out and about and have a fever, have muscle aches or a cough, you're going to spread the flu. So we say stay home at least 24 hours after your symptoms have resolved. Those are good tips.